How's it going, guys? This is yours truly, Hans Silverberger 82. Today I'm going to do something rather disgusting, but I decided to try it because someone recommended me to do it, so whoever the hell you are, here you go. Okay, so this is going to be some surgery. I'm going to fucking do surgery on an ingrown toenail removal. If you don't know what it is, you're about to find out. The surgery may contain graphic procedures inappropriate for children or squeamish adults. Viewer discretion is advised. SurgerySquad.com is not suitable for professional medical advice.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff.
Hi, Dr.
And I'll
Jeff.
be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
They
An
zoomed in
ingrown
on it.
toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too
can't even
loose.
look at it. It looks
Improperly
nasty.
trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail,
Diabetes.
it is recommended that you go to the doctor immediately.
Threat has been
Now that you
detected.
understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Oh, hell no.
Our patient is ready, so let's begin by disinfecting the toe.
Alright. Hello, patient. My name is Dr. Feel Up On Me. Alright, click and drag the surrounding area. Click. Continue on them. Oh, it's like painting toenails. Alright, we're just going to add a little dab here. Missed the spot right there. You know what? Might as well just paint all your toenails. Okay, continue. All
Now,
right.
we need to
Oh,
numb
fuck,
the
I
toe
didn't-
with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Click and inject it. Okay, this... I had a little bit to drink before I came to do surgery, so... which toe are we doing again? The small toe. We're doing the big toe, right? Ew.
Threat
There
has been
goes
detected.
one. Shut up, I get it. I have a virus. I'm fucked, okay. Ugh.
Great. Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to...
Ugh.
First, carefully slide one blade of the nail anvil under the affected nail.
Oh my god.
We're going to go down the nail until we feel a
my
little bit
God.
of resistance.
This is
Our
nasty as
patient's
hell.
going to feel some pressure as we cut away the ingrown nail.
Click where ingrated to cut away. I don't want to click on it anymore. Oh, this is hurting me more than it hurts you. Oh, shut up.
Detected.
Take the forceps and carefully remove the ingrown nail.
No, stop it. Come on, just take it. Oh, okay.
It's getting kind of messy in there. Let's clean up that blood.
That's what she said. I'm so sorry. Am I even cleaning it? Oh, okay, now it's fucking cleaning.
See that small bit of pale yellow substance right there?
It's pus.
It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that
I
infection
was
out as
afraid
you
they were
can.
going to tell me to do this. And this is why I became a YouTuber, not a doctor, because I'm very fucking squirmish when it comes to, like, fucking feet or shit like this. You know, I wouldn't mind sawing a guy in half or something like that, but when it comes to, like, downright gross shit like this, I wouldn't be able to do it. If you want to go ahead and become a doctor, do it. If not, then go become a prostitute or something. No, I'm just fucking around. Just be a kawaii potato. Oh, ew. Ew, looks like a jelly donut. Ugh. A really nasty ass fucking jelly
That
donut.
toe is starting to look much better.
No,
But
it's
we're
not.
done
It
yet.
looks horrible.
Next, we're going to apply some phenylacid to the wound. This will help ensure that the problem of ingrowth will not... When you're done inserting the acid,
Oh.
I'll remove the tourniquet and we'll finish up.
He's digging in there. Oh, What the fuck?
Finish by applying some antibiotic ointment on a sterile gauze pad.
Some lube.
Place it against the toe and wrap it in a gauze bandage.
Okay, you know what? Might as well you do that because I ain't doing shit.
Fantastic job. Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics.
Threat has
We'll
been
also need to
detected.
tell our
Shut
patient
the
to keep
fuck
the
up.
wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow,
what the
his
fuck?
condition is likely to return if he doesn't take care of his
What
feet.
the fuck,
This
dude?
includes wearing proper fitting
There's-
shoes,
there was no
properly
toenail
trimming
there.
his toenails,
It was
and
just
keeping his
fucking
feet clean
skin.
and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Let's do laser surgery.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie.
Hello,
I'll be
Miss
guiding
Susie.
you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible.
Oh, pain-free
So we'll
bullshit.
use drops to numb the eye. Can you place a few drops into her eyes?
Does it sound like I'm in a fucking Dora the Explorer or children's program? Alright, let's just put some in your nose. Your ears too. Alright. There you go. I don't understand how you're
Even
not
with the
blinking
numbing
by now.
drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
Ugh.
So let's get that speculum over. If the patient was allowed to blink, we might cut or burn the wrong area.
Oh, fuck.
At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction
Fact.
ring over the eye.
Oh, this is weird
The
as
ring
fuck,
sucks
man.
the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring.
Holy fuck.
We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along
Slide
the
it.
track to create
Slide
a
it,
thin
come on.
flap in the cornea.
It sliced it. Did it slice? Did it slice it or not? Oh, there it goes. Ugh.
With the corneal flap cut, we remove the
sliced?
microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Ah,
This
dude,
is the
what the
part we'll
fuck?
reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position, making sure our ink guides match up. Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye.
Eye
This
patches.
keeps the patient from bumping or rubbing her eyes. The patient will
Threat
notice
has
the
been
improved
detected.
vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on SurgerySquad.com.
The fuck? I am not gonna fucking do the fucking dental one, cause fuck that shit. I had, for those who don't know, I had 2 of my fucking wisdom teeth removed from my mouth, numbed. It was the worst fucking feeling in the world. I am not gonna fucking do this virtually. If you guys enjoyed any of this, make sure to hit the like and subscribe button. If you guys want to see me do more of this virtual surgery shit, maybe the dental one, tell me down in the comment section below. If you guys want to play this game for yourself, the website is called SurgerySquad.com. Again, it is called why the fuck am I saying SurgerySquad.com. Thanks for watching, guys. As always, I will see you in the next video. This is Hans Celebrator signing out. Bye-bye.